Hello, I'm Dr. David Kent with Skincare Physicians of Georgia here in Macon, Georgia. And we're here today to talk about a problem that literally affects so many people that we see not only in our practice, but as a problem that affects people literally globally, and that's hair loss. We know that hair loss is a problem for both men and women. It can begin as early as their early 20s or potentially late teens and can continue throughout their lifetime. So what I'd like to do today is to give you a kind of an overview of hair loss, some of the problems that we see, some of the problems that patients have, how we evaluate patients, and how we now have not only surgical options for patients such as hair transplants, but fortunately now we have many effective non-surgical options for patients to improve their hair growth. So let's go ahead and get started. We know that the face is framed by hair, and so it's important from just a visual aspect. There's some very interesting statistics about patients' hair and how it affects them, and how I would say in some studies over 50% of patients have reported that they sometimes feel they're being evaluated or judged by this, and over 70% of patients often dream about having a thick, more luscious head of hair. For myself, my hair thinning actually started in my early 30s, and here we are today. But I'm actually thrilled to wake up every morning, and this has really not been a big problem for me, but for many of my patients, it is a problem, and that's why I want to talk with you about that today. Well, the first thing that happens is they come in and we evaluate the patients. We get their history, we find out when did their hair loss begin, have they had any medical illnesses, what about certain stress. We know that stress, certain inflammatory conditions in the environment definitely have an impact on the hair cycle. Have patients, do they have other medical illnesses? And all this goes into the evaluation of their hair loss. In addition to using oral medication and topical medications, there are actually two very effective non-surgical interventions that patients can do that have been shown to be very beneficial. The first is something that perhaps you may have heard of, and that's called PRP, or platelet-rich plasma. Platelet-rich plasma is a product that you actually have plasma in your body circulating. So what happens is we do a very simple blood draw in the office that is spun down, and the plasma fraction contains what's referred to as platelets. Platelets have many important functions, not only helping with once you get a cut and helping stop the bleeding, but they also contain numerous growth factors. And these growth factors are incredibly helpful in a variety of aspects of the hair growth cycle. We know that they can actually stimulate the stem cells to grow more hair. It elongates and improves the growth phase of the hair. It can also have anti-inflammatory properties. So there are many different steps that PRP can actually do to help improve hair growth. There are basically two types of platelet-rich plasma. There's PRP, which is just the platelet-rich plasma, and then there's something which we call PRFM, which stands for platelet-rich fibrin matrix. And this is the one that we primarily use for hair loss. Let me explain to you what the difference is. When you inject PRP in just by itself into the scalp, it can literally diffuse away from the site of injection. What PRFM is, or platelet-rich fibrin matrix, imagine that you're injecting this fine network, if you will, that almost looks like a spider web. It's invisible. And the platelets are actually bound and bind to this fibrin matrix and hold the platelets at the target site for a longer period of time for them to release those powerhouse granules that have all these growth factors. And we have found that the latter has been incredibly effective. The evidence-based medicine for this certainly exists, and there are numerous published studies in what's referred to as peer-reviewed journals that show how effective it is. In summary, the data shows that a series of either 3 or 4 injections, 1 a month for 3 or 4 months has been very effective. Now, it's not just a single injection. We use extremely tiny little needles to place the medicine in the desired depth in the scalp. And one of the problems that patients come to us, or one of their fears, I should say, is what about the discomfort with all those tiny needle injections? Well, here at Skincare Physicians, we actually have 2 options to help our patients have virtually no pain. The first is we've developed a very unique technique for painlessly blocking the scalp so that the injections, literally, they can't feel. The second is for patients that don't want that, we can actually use something called Pronox. This is the laughing gas like people get when they go to the dentist. And so literally after 90 seconds of inhaling this, they are very comfortable and the medication is placed, or the platelets, PRP is injected painlessly. The second option, which is newer and many of you may not be familiar with, is actually a product that we use topically on the scalp, and this is called exosomes. So you may ask, what are exosomes? Well, exosomes are these tiny nanoparticles that are secreted from stem cells. And these actually are able to be just like PRP molecules, messenger molecules that can activate and have growth factors, both defined growth factors as well as a messenger RNA that can stimulate the growth of hair. And there's a unique difference between PRP and exosomes. And one of the biggest differences is the size of the particle. Imagine the size of the particle for comparison purposes. For PRP, you can think of it like a grapefruit. But the size particle for exosomes, for comparison, is like that of a grain of sand. So you can actually apply the exosomes topically, and that can be done one of several ways. Sometimes what we'll do is we'll do very fine microneedling of the scalp to create these very tiny transient channels before the exosomes are applied and smeared in, and they're readily absorbed. We can also do something that's also very new and very effective called laser drug delivery, where we can use a laser to drill these very, almost the size of a human hair, these tiny little holes in the scalp, which create these tiny transient channels for which the exosomes are then allowed to penetrate. So we can actually use both of these together, typically not at the same treatment time. So we may do the exosomes and then on a different week do the PRP. An additional treatment which we've also found to assist in both PRP and exosomes are some nutritional supplements. And there are some very well recognized supplements that can help add and improve patients' hair growth. So as you can see, it's not a one-size-fits-all. Here at Skincare Physicians, we customize each option, each therapeutic option for what makes sense for our patients that come in.